See, dementia is a condition where a person starts forgetting, and also there are other cognitive derangements. And usually when we talk about dementia, we think of Alzheimer's disease, which is a degenerative disease of the brain, where various parts of brain they shrink, they have develop atrophy, and then over a period of time the person starts forgetting and also loses other cognitive abilities. So even though we have medications to improve the symptoms, but at present there is no cure for Alzheimer's. So when we see a patient with dementia, we always try to look for something which can be treated or something that can be reversed. So today I will talk about three conditions which can cause dementia, and there we can treat or reverse them. So one thing in our context is vitamin B12 deficiency. So vitamin B12 is something very useful for nerves and including the brain. And if there is a vitamin B12 deficiency, the person can develop dementia and memory impairment and other cognitive dysfunctions. And there the important thing is, patients can have other symptoms like tingling or burning of the feet, and even sometimes hyperpigmentation of the knuckles. So if there are an anemia, so hemoglobin also may drop. So whenever we diagnose B12 deficiency and then treat them, then dementia also improves, and it's one of the causes of reversible dementia. So vitamin B12 deficiency can occur in anyone, but it is more common in those who consume plant-based diets, and because plants do not produce B12. The second condition where I want to highlight is hypothyroidism, where there is a deficiency of thyroid hormone. So if thyroid hormone has many functions, and one of the functions is to maintain brain cognition, and we know that patients who have hypothyroidism, including children, if they are not adequately treated, they can develop dementia and cognitive dysfunction. So if we can diagnose hypothyroidism, treat them on time, then the cognition improves. And so this also is one of the treatable causes of dementia. And the third condition I want to talk, which occurs mostly in older people, a condition what we call NPH, or normal pressure hydrocephalus. So in that the person has dementia. Along with that dementia, the person has walking difficulty and also urinary symptoms. So when you see a person who has a triad of these three, that is dementia with walking difficulty and urinary incontinence, then think of NPH. So with the help of MRI and also something called as CSF drainage, we can confirm that it is NPH. And then in such patients, if we do shunt surgery, it improves many functions, including their walking, and in many cases the memory also may improve. So there are many other causes of reversible dementia which I have not discussed today, but I wanted to talk about these three conditions which I have seen recently, where treatments made a real difference and patients did get better.